There are many different types of devices out there. In the next section, we will discuss the types of devices, how to tell they are empty, and where to look for expiration dates. There are three main styles of delivery devices. These include dry powder inhalers, aerosol inhalers, and inhalers that create a soft mist to breathe in. Each one has different tricks to ensure the medication gets into your lungs to help you breathe better. We will discuss each one individually. Dry powder inhalers. These include the Genuair, pictured top left, the Breezehaler at the right corner of your screen, the Ellipta in the bottom left, the Turbuhaler in the bottom middle, as well as the Handyhaler in the bottom right corner of your screen. Some have the powder stored in the device, and others have a capsule that must be placed in the device and crushed with each use. Dry powder inhalers usually require a faster inhalation. It is also important to exhale well before putting the inhaler in your mouth so you can get the powder deep in your lungs when you breathe in. The websites for each brand of inhaler have demonstration videos on how to take the particular inhaler. If you have questions, please contact your doctor, pharmacist, or COPD educator. Each device has a different counter or method of determining how many doses are left. Both the Genuair and Ellipta devices have a large counter on the front. The Turbuhaler has a small window when you remove the cover. There are small numbers in this window. When you are down to the last 20 doses, you will see some red appear. When the window is fully red, there are no more doses. If you shake the device, you will feel desiccant. This does not change. It helps to keep the powder medication dry. The capsule-based inhalers have expiry dates on the packages of capsules. Again, if you have questions, please ask your pharmacist when picking up your medication. It is important to know the expiry date of your medication. If the powder is inside the device, the expiry date will appear on the device. If the powder is in capsule form, the expiry date will be on the foil packaging of the capsules. Please do not use any medication that is past the expiry date. Any expired, unused medication should be returned to your pharmacy for proper disposal. A number of different inhalers come in aerosol form. The medication sprays out of the inhalers very quickly. The next slide will outline how to properly use these medications. When you use any inhaled medication, it can only do its job if it makes it into your lungs. Since aerosols come out of the device so quickly, a spacer device should be used to help you get the medication deep in your lungs. This device can also reduce side effects as less of the medication will end up on the back of your throat and in your mouth, and more will get to your lungs where you need it. This slide outlines how to properly use a spacer. First, take off the caps. Shake the inhaler. Place the inhaler into the rubber or silicone end of the chamber. Get ready to spray by placing your finger on the top and your thumb on the bottom of the inhaler. Exhale gently. Spray the medication into the chamber and inhale slowly. Try to avoid hearing the musical note, which will happen if you breathe too quickly. Hold your breath for 10 seconds and then shake well and wait 30 seconds before the next puff. This will ensure the medicine loads in the canister before you spray your second dose. How to tell they are empty. Pull the metal canister out of the plastic holder. Give it a shake. Listen and feel for medication moving in the canister. It will still spray when the medication is gone. If you can't feel anything moving or hear anything moving when you shake, it is likely that your inhaler is empty. The canister contains both medication and propellant. The expiry date will be printed on the side of the canister. This next section will look at the soft mist inhalers. These inhalers come in a box with two pieces that need to be put together. Your pharmacist can demonstrate how to do this the first time, or if you have questions. How to use a soft mist inhaler. In order to load the canister when you receive your box, press the safety catch and pull the clear base from the device. You may press the canister or cartridge into the device, then place it on a table to give it a press until you hear a click sound to know that the canister is fully loaded. To inhale the medication, twist the clear base 180 degrees, open the cap, and pressing the button, breathe in at the same time to receive the mist. There are instructional videos made by the company that makes your inhaler that will go through this more clearly. The soft mist inhaler has a dial on the side of the canister showing you how many doses are left. The red arrow will move from the bottom full zone, which is green, up towards the red empty zone as you use the medication. Expiry dates will be printed on the canister and on the box. If you have questions about the soft mist inhaler, please ask your pharmacist, your doctor, or your COPD educator.